Dear students, in Lifestyle Diseases and Prevention subject, today we are going to discuss a new topic called kidney stones. In this topic, we are going to see the detailed information regarding the progression of kidney stones, that is, how far the kidney stones are being progressed in the human body, that is the basic pathophysiology behind in the kidney stone formation. This kidney stone formation is very familiarly known as renal calculi or nephrolithiasis or urolithiasis in general. Okay, we will discuss the basic pathogenicity of kidney stone formation, what are the major symptoms of kidney stones, the available diagnostic methods for kidney stones, types of kidney stones, and the treatment options available for the renal calculi. In this flow, we will discuss this topic in detail. Okay, right. Kidney stones are hard deposits made of minerals and salts that form inside the kidneys. Diet, excess body weight, some medical conditions, and certain supplements and medications are among the many causes of kidney stones. Kidney stones can affect any part of your urinary tract, from your kidneys to your bladder. Often, stones from when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful, but the stones usually cause no permanent damage if they are recognized in a timely fashion. Depending on your situation, you may need nothing more than to take pain medication and drink lots of water to pass a kidney stone. In other instances, for example, if stone becomes lodged in the urinary tract or associated with a urinary tract infection or cause complications, in that case, surgery may be needed. The doctor may recommend to prevent treatment to reduce the risk of recurrent kidney stones if you are at high increased risk of developing the renal calculi again and again. Now we will discuss what are all the major symptoms available for kidney stones. How can we confirm whether we have kidney stone in the body? A kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureter, the tubes connecting the kidneys and the bladder. If it becomes lodged in the ureters, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. At that point, you may experience the following major signs and symptoms. That includes severe sharp pain in the side and back below the rib, pain that radiates to the lower abdomen and groin, pain that comes in waves and fluctuates in the intestinal region, pain or burning sensation while urinating. Apart from these symptoms, there are some other signs which are also characterized related to renal stones. Includes pink, red or sometimes brownish urine, cloudy or foul smelling urine, a persistent need to urinate, urinating more often than usual, or urinating in small amounts, nausea and vomiting, fever and chills if an infection is present. Pain caused by kidney stone may change. For instance, shifting to a different location or increasing in intensity as the stone moves through your urinary tract. So these are all the major symptoms through which we can confirm with the individual who are susceptible for having the problem of kidney stones. When should we meet a doctor? When the pain is so severe and leads to the individual who fails to sit or find a comfortable position. Pain accompanied by nausea and vomiting. Pain accompanied by fever and chills. Blood in the urine. Difficulty in passing urine. While you encounter any one of the following signs, what I said now, you are supposed to consult with a medical physician immediately. Now we will discuss the major causative factors for kidney stone formation in the human body. Kidney stones often have no definite single cause, although several factors may increase the risk. Kidney stones form when your urine contains more crystal forming substances such as calcium, oxalate and uric acid. Then the fluid in your urine can dilute. At the same time, your urine may lack substances that prevents crystals from sticking together, creating an ideal environment for kidney stones to form. So these are all the major reasons behind the kidney stone formation in the kidney. Types of kidney stones. Knowing the type of kidney stones may help to determine its cause and may give clues on how to reduce the risk of getting more kidney stones. If possible, try to save the kidney stone if you pass one, so that you can bring it to the doctor's attention for more information. Types of kidney stones include calcium stones, struvite stones, uric acid stones, cystine stones. Calcium stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate. Oxalate is a substance made daily by the liver or absorbed from the diet. Certain fruits and vegetables as well as nuts and chocolate have high oxalate content. Dietary factors that includes high dose of vitamin, intestinal bypass surgery and several metabolic disorders can increase the concentration of calcium or oxalate in the urine. Calcium stones may also occur in the form of calcium phosphate. This type of stone is more common in metabolic conditions such as renal tubular acidosis. It may also be associated with certain medications used to treat migraines or seizures such as topiramate, which is commercially called as Topomax, Quadaxi and Trokendi. Next one, struvite stones. Struvite stones form in response to a urinary tract infection. These stones can grow quickly and become quite large in size, sometimes with a few symptoms or little warning. The third one is uric acid stones. Uric acid stones can form in people who lose too much fluid because of chronic diarrhea or malabsorption, those who eat a high protein diet, and those with diabetes or metabolic syndrome. Certain genetical factors also may increase the risk of uric acid stones. Cystine stones. These stones form in people with a hereditary disorder called dystinuria that causes the kidneys to excrete too much of a specific amino acid. Now we will discuss the general risk factors that are associated with kidney stones. Number 1, family or personal history. If someone in your family has had kidney stones, you are more likely to develop the kidney stones too. If you have already had one or more kidney stones, you are at increased risk of developing it again. Number 2, dehydration. Not drinking enough water each day can increase your risk of kidney stones. People who live in warm, dry climates and those who sweat a lot may be at higher risk than others. Number 3, certain diet system. Eating a diet that is high in protein, sodium and sugar may increase the risk of some types of kidney stones. This is especially true with a high sodium diet. Too much salt in your diet increases the amount of calcium your kidney must filter and significantly increases the risk of kidney stone formation. Obesity. High body mass index, large waist size and weight gain have been linked to an increased risk of kidney stones. The next one is digestive diseases and surgery. Gastric bypass surgery and inflammatory bowel disease or chronic diarrhea can cause changes in the digestive process that affect your absorption of calcium and water, increasing the amounts of stone forming substances in the urine. Other medical conditions such as renal tubular acidosis, cystinuria, hyperparathyroidism and repeated urinary tract infections also can increase the chance of kidney stone formation in the body. Certain supplements and medications such as vitamin C, dietary supplements, laxatives, that is when we use the laxative excessively, calcium based antacids and certain medications used to treat migraines or depression can increase the risk of kidney stone formation in general. So that's all the major risk factors associated with the kidney stone formation. Now we'll discuss the major diagnostic procedures available for kidney stone identification. Blood testing. Blood tests may reveal too much calcium or uric acid in the blood. Blood test results help to monitor the health of your kidney and may lead the doctor to check for other medical conditions. Urine testing. The 24-hour urine collection test may show that you are excreting too many stone forming minerals or too few stone preventing substances. For the test, the doctor may request you to perform 2 urine collection over 2 consecutive days. Imaging. Imaging tests may show kidney stones in your urinary tract. High speed or dual energy computerized tomography will help in getting the information about the kidney stone formation. Simple abdominal X-ray are used less frequently because this kind of imaging tests can miss small kidney stones. Ultrasound, a non-invasive test that is quickly and easy to perform, is another imaging option to diagnose the kidney stones. Analysis of past stones. You may be asked to urinate through a strainer to catch stones that you pass. Lab analysis will reveal the makeup of your kidney stones. The doctor uses this information to determine what's causing your kidney stone and to form a plan to prevent more kidney stones further. That's all the major diagnostic procedures available to confirm the progression of kidney stones in the body. Now we will discuss the major treatment options available for kidney stones. Small stones with minimal symptoms can be treated like drinking more water. Drinking as much as, that is 2 to 3 quarts a day, will keep your urine dilute and may prevent stone forming. Unless your doctor tells you otherwise, drink enough fluid. Ideally, mostly water, to produce clearly or nearly clear urine. Pain relievers. Passing a small stone can cause some discomfort. To relieve mild pain, your doctor may recommend pain relievers such as ibuprofen or naproxen sodium. Medical therapy. Your doctor may give a medication to help pass your kidney stone. This type of medication known as alpha blocker, which relaxes the muscles in your ureter, helping you pass the kidney stone more quickly and with less pain. Examples of alpha blockers include tamsulosin, that is Flomax, and the drug combination dutasteride and damsulosin. So these are all the medical drugs available for elimination of the kidney stone through the normal urine passage. What can we do with the cases, that is large stone and those that cause symptoms? Kidney stones that are too large to pass on their own or cause bleeding, kidney damage, or ongoing urinary tract infections may require more extensive treatment. The procedures may include using sound waves to break up the stones. For certain kidney stones, depending on size and location, the doctor may recommend the procedure called extracorporeal shock wave lithotripsy, that is ESWL. The next option is surgery to remove very large stones in the kidney. A procedure called precutaneous nephrolithotomy, which involves surgical removal of a kidney stone using small telescopes and instruments inserted through a small incision in your body. You will receive general anesthesia during the surgery and be in the hospital for 1 or 2 days while you recover. The doctor may recommend this surgery if ESWL is unsuccessful. Using a scope to remove the stones. To remove smaller stone in your ureter or kidney, the doctor may pass a thin catheter equipped with a camera through your urethra and a bladder to your ureter. Once the stone is located, special tools can snare the stone or break it into small pieces that will pass out through urine. The doctor may then place a small tube in the ureter to relieve swelling and promote healing. You may need general or local anesthesia during this procedure. Parathyroid gland surgery. Some calcium phosphate stones are caused by overactive parathyroid glands, which are located on the 4 corners of your thyroid gland, just below your Adam's apple. When these glands produce too much parathyroid hormone, your calcium levels can become too high and kidney stones may form as a result. Hyperparathyroidism sometimes occurs when a small benign tumor forms in one of your parathyroid glands, or you will develop another condition that leads these glands to produce more parathyroid hormone. Removing the growth from the gland stops the formation of kidney stones, or your doctor may recommend treatment of the condition that causing your parathyroid gland to overproduce the hormone. Now we will discuss the major preventive options, that is including lifestyle changes and treatment procedures. Drinking water throughout the day. For people with a history of kidney stones, doctor usually recommend to drink enough fluid to pass about 2.1 quarts, that is nearly 2 liters of urine in a day. If you live in a hot, dry climate, you exercise, or if you have the habit of exercise, you may need to drink even more water to produce enough urine. The next one is eat fewer oxalate-rich food. If you tend to form calcium oxalate stones, your doctor may recommend to restrict foods which are rich in oxalates. It includes rhubarb, beets, okra, spinach, chard, sweet potato, nuts, tea, chocolate, black pepper, and soy products. So these are all the products which have more oxalate in their composition. Choose a diet low in salt and animal protein. Reduce the amount of salt you eat and choose non-animal protein sources such as legumes. Consider using a salt substitute such as other commercial varieties. Continue eating calcium-rich foods, but use caution with calcium supplements. Calcium in food doesn't have an effect on your risk of kidney stones. Continue eating calcium-rich foods unless your doctor advised to stop. Ask the doctor before taking calcium supplements, as these have been linked to increase the risk of kidney stones. You may reduce the risk by taking supplements with meals. Diets low in calcium can increase kidney stone formation in certain people. So these are all the major lifestyle changes that can be used to prevent the formation of kidney stones. Medications. What are the major medications available to manage kidney stones? Calcium stones. To help prevent calcium stones forming, the doctor may prescribe a thiazide diuretic or a phosphate containing preparation. Uric acid stones. Your doctor may prescribe allopurinol to reduce uric acid levels in your blood and urine, and a medicine to keep your urine alkaline. In some cases, allopurinol and an alkalizing agent may dissolve the uric acid stones. Sruthi stones. To prevent struvite stones, the doctor may recommend strategies to keep your urine free of bacteria that cause infection, including drinking fluids to maintain good urine flow and frequent voiding. In rare cases, long-term use of antibiotics in small or intermittent doses may help achieve this goal. For instance, the doctor may recommend an antibiotic before and for a while after surgery to treat your kidney stones. Cystine stones. Along with suggesting a diet lower in salt and protein, the doctor may recommend that you drink more fluids so that you produce a lot more urine. If that does not help, the doctor may also prescribe a medication that increases the solubility of the cystine in your urine. So students, that's all about the major informations for medications related to kidney stones. So far we have discussed what is meant by kidney stone, what are all the major symptoms, risk factors, diagnostic procedures, lifestyle changes needed to prevent kidney stones, and the medication practices to treat kidney stones. So you prepare according to this flow for your university examination. We'll discuss a new topic in the next class in detail. Thank you so much.